Good morning, everybody. It's Dr. Galvin with the my post-emergency department shift coronavirus update. Today is Tuesday morning, April 21st. Night in the ER was fine. A little shorter shift than usual. They cut our shifts by 2 hours, so normally I come in at 8 and leave at 6, and last night I came in at 10, so that was a little different. The night was relatively sedate, not a lot of really sick patients for whatever reason. You know, feast or famine in the emergency department. We don't like to use the Q word, and since I'm leaving, I can use the word quiet, but we never say that in the emergency department because it jinxes us. But last night was a relatively sedate night. It was fine. Numbers today: 2.5 million cases worldwide, 170,000 deaths, 650,000 recoveries, though, so that's great news. In the U.S., we're up to 800,000 cases, 42,000 deaths. That's 1,600 people since yesterday. So 1,600 people that were alive yesterday are dead today because of the virus. 72,000 people have recovered in North Carolina, 6,800 cases, 179 deaths. We had 15 deaths in the last 24 hours. The number of coronavirus deaths just in North Carolina just surpassed the number of flu deaths. And people are like, oh, the flu and corona, they're the same. Well, remember, we normally get, let's see, I wrote it down here. We normally have 167 deaths attributable to the flu in North Carolina every year. So year long, 167. We've had 179 deaths since COVID first came. And our first death in North Carolina was 27 days ago. So 27 days of corona were above the number for the flu. And so the folks that are saying that the flu is, corona is just the flu, and I think you're sorely mistaken, and I think the numbers prove that. If you don't believe it, I don't know what to tell you, but 27 days and a lot of people dead. Interestingly, the health departments in Mecklenburg County, which is the county that largely encompasses Charlotte, we're just a little north of Charlotte here, has shown that we have flattened the curve in the area. And they project if about 45% of the population continues to do social distancing, then we're going to hit our peak locally on the 27th of June. Now, if only 30% do it, we're going to hit our peak on the 16th of June. And if 60% of people do it, then we're going to hit our peak July 17th. Now, what does that mean, the peak? Well, why do we worry about that? Well, we worry about it because of the fact that is sort of that intersection of hospital capacity and people that need care. And if we exceed that, then it's a problem. So even at the peak locally, it does not look right now like we're going to exceed hospital capacity. The projections based on the current data available in North Carolina are that on the 27th, we are going to need about 2,060 beds for patients who are sick enough to require hospitalization for COVID-19. And locally, we have 2,600 beds, so that's pretty good. So we're not going to exceed the capacity of the hospitals if we continue doing what we're doing. The problematic thing is the projected number of ICU beds at that time is about 1,140 beds need to be people of those people are going to need ICU level care, and we only have about 280 beds locally. And we probably don't have the number of ventilators, although ventilation strategies are changing. Maybe that won't be as big an issue. But again, the social distancing here has helped, and that's encouraging signs, and we're certainly not seeing the crushing numbers of cases that they saw in New York or still seeing in New York. And I've had conversations just recently with physician colleagues there and hearing about just the absolute crushing numbers that they saw. We have not seen that here, luckily. The question now is opening. We've got South Carolina that's going to open, and all these people are coming and saying they're going to open again. And I've been asked many times, what do I think about this? Well, I don't think it's very smart. And the problem is this: without data, we really can't determine when to open. And if we don't test, we can't get the data. In North Carolina, we've done 80,000 tests. We need to do far, far more, and we need to do broad-based antibody testing to see how prevalent the virus is locally, because that's the only way we're going to know, A, how much farther we have to go to achieve herd immunity, and B, what's going on right now, and what our projections are based on are models that are based on essentially guesses right now. And if you fill a model with guesses, then you're going to get wildly disparate views, and we're seeing that. That's why these models are kind of all over the place. And until we get that testing done, which is absolutely critical, both testing of infected people and testing of people that have antibodies that may be immune potentially, we really won't be able to have the right data to put into the models. And right now, opening things up without having that data is just like, I'm going to flip a coin. It's either going to be better, it's going to be worse. And we could potentially put a lot of people in harm's way. And listen, I get it. I understand people are wanting to open up. And I'm a business owner. I want to open up too. But I also don't want to kill a lot of people unnecessarily. And I don't want to overwhelm the system and cause a bigger problem and have us look like Italy, as opposed to what we're looking at right now. And the numbers are encouraging. So somebody sent me a little meme. It was funny. You don't, when you're in your parachute and you start slowing down, you don't suddenly take the parachute off. And, I think that's actually pretty apt for what we're considering doing without really even knowing how high we are. And, if we're 1 foot above the ground, maybe it's okay. But if we're 1,000 feet above the ground, we got a problem. The other thing we really need to do a better job is contact tracing. What is contact tracing? Contact tracing means that if I have the virus and I get diagnosed with it, what we really want to know is who I've been around for the last week. Because remember, the natural progression of the virus is that you get infected, and then you have a period of time that goes anywhere from a couple days to a week where you are asymptomatic, meaning you have no symptoms whatsoever, yet you're able to spread the virus. And so if I have the virus and I develop symptoms, 3 days from now, well, I could potentially have been infecting people all week long. And so it's incumbent upon the health department or whoever to then trace those contacts. So they've got to come to me and say, where did you go? Who were you around? And then they need to go and find those people and test them. And contact tracing is key. Now, South Korea and China used your phones, and they basically were able to backtrack based on your phone location, which gets tracked. And they completely threw privacy out the window, and they were able to track people via their phones, and they were able to isolate these contacts, and so they were able to significantly slow the spread. Now, in the US, I don't think any of us wants the government having unfettered access to our phones and our tracking data. But Google and Apple are working together to provide a service where that data is anonymized. And Google, I'm not sure about, but Apple has been a real staunch advocate of privacy, and I'm a big believer in privacy. And maybe they do have a system that allows to do contact tracing, and you can opt in and find out if you've been around anybody. And it's important because obviously, if we've been around somebody that's had the virus, we're going to change our behaviors, and we may need to isolate ourselves, but we're certainly going to avoid those risky folks that could really, really get sick from this. I think the news is good. I think we're starting to flatten the curve. I am hesitant about, again, taking that parachute off too soon. I think that could be a very, very grave mistake. I'm tired. People asked me about this is my new little mask. It's called an Envo mask, and it's actually pretty comfortable. It kind of goes like this and clicks over your ears. And it's got a gel cushioning here, so this is a lot more comfortable. Wearing these masks is crazy. We hate it. We come in, our faces are all like imprinted. My normal routine, I haven't done it yet, but I come in our little physician office, and I take all the stuff off and wipe it all down with bleach wipes, and then I strip my clothes off, put them in a paper bag, get in the shower, scrub down, change my clothes, change my shoes, and then get out of here, and then dump all that stuff in the washer right away. So anyway, I will talk to you guys tomorrow with a further update. If you find these updates useful, please like our the Vitality page, follow us. And if you want to subscribe to our YouTube page and hit the little bell, you'll get updates when we post videos. My goal for the next week, I'm a little bit of a busy guy, but I am really, really trying to get as much information out there as possible. And my goal this week is to start filming these short, single question answer videos. So, people want to know, does hydroxychloroquine work? Well, I'm going to film some videos that just answer that one specific question so that you can you can search and find just the answer to your particular question. I've been told that we should host the videos on YouTube and then post them back to Facebook. We're going to try that today. So it's going to look a little bit different today probably than it usually does. Bear with me. I'm a complete novice. We do have some help and some people that know actually what they're doing, and I'm trying to make it as easy for everybody that's watching as possible. As I always say, take care of yourselves, take care of those around you, take care of your families, wash your hands. Remember, soap kills the virus. Keep isolated. Don't believe the hype. Fact check the information you're being given, and I will talk to you tomorrow. Good morning or good night.